In this training video, I will teach you how to prepare for a certified nursing assistant interview. If you are applying to become a CNA with any hospital, medical facility, or NHS trust, make sure you stay tuned because the tips, questions, and unique sample answers I am about to give you will help you pass your interview at the first attempt. And to achieve that goal, I will cover the following 4 things in this training tutorial. Number 1, I will tell you which questions are most often asked in certified nursing assistant job interviews. These questions come up all the time. Number 2, I will give you 2 vital tips for giving a top scoring answer to each CNA interview question. Number 3, I will then give you a brilliant example answer to each interview question to help you pass your interview at the first attempt. And then finally, number 4, I will tell you where you can instantly download my 27 great answers to certified nursing assistant interview questions. And just very quickly, if you are new to my channel, please make sure you hit that subscribe button. Thousands of you, and I mean thousands of you, are getting hired at the first attempt. It makes it far easier for me to help you when you are subscribed. And please hit the like button because that genuinely motivates me to create more great content for you. Now, during your CNA interview, there are certain skills you need to demonstrate. There are 7 skills I recommend you talk about in your answers to the interview questions. Number 1, compassion and empathy. Number 2, strong communication skills. Number 3, attention to detail. Number 4, physical stamina to meet the role's demands. Number 5, time management and organizational skills. Number 6, teamwork and collaboration, which is your ability to work closely with other healthcare professionals. And finally, number 7, emotional resilience. And in the answers that follow, we will incorporate these 7 skills and qualities because that will help you answer the questions more confidently and ultimately get you hired. So the first question you will have to answer at your certified nursing assistant interview is going to be, tell me about yourself. Here are 2 vital tips for giving a strong and confident answer. Tip number 1. So this is going to be the first question you will have to answer at your CNA interview. I strongly recommend you practice your answer several times before the interview because that will help demonstrate good communication skills, which is a skill required in the role. And tip number 2, in your answer, I recommend you talk about the following 4 things. Write these down. The skills you can bring to the role, your experience or educational background, achievements, and the type of nursing assistant you are and what you will do in the role to help the hospital thrive. And you will notice that those 4 things stand for SEAT, S-E-A-T. And you can remember my seat structure for tell me about yourself because you will be sitting down on a seat at your certified nursing assistant interview. So here is a brilliant example seat structure answer to this question, tell me about yourself. Here we go. Thank you for this opportunity. My skills are an excellent match for the job description. I am compassionate, a strong communicator, patient, and a good collaborator. My experience in patient care, infection control, and communication with patients, families, and medical staff means I am ready-made for the role. I am a high achiever. In my previous position, I was recognized for playing a key role in reducing patient falls by 30% over a 6-month period by implementing regular mobility checks, as well as contributing to a 20% increase in patient satisfaction scores through attentive care. If you employ me as a certified nursing assistant, I will work diligently to ensure the values of this hospital are demonstrated in all of my work. Thank you for listening. So that is a brilliant example seat structure answer to that first CNA interview question, tell me about yourself. And you can see how effective my seat structure is. Now you can either pause the video if you want to and write down the questions, tips and answers as we work through them together, or if you wait, I will soon tell you where you can instantly download these slides plus my full set of 27 top scoring answers to certified nursing assistant interview questions. Here is the next question I strongly advise you prepare for. Why do you want to be a certified nursing assistant? Now, this next common question is assessing your motivations for wanting to become a certified nursing assistant. A significant level of responsibility comes with being a CNA, so make sure you give an answer that demonstrates your passion for delivering first-class care and treatment. Now, good things to include in your response are how you get to have a positive impact on people's lives as a certified nursing assistant, the fact that no 2 days are ever the same, which gives you lots of job variety, and also the job security that comes with being a CNA, and also the opportunity to specialize in different healthcare areas. So here is another top scoring example answer to help you pass your CNA interview. Why do you want to be a CNA? I want to be a certified nursing assistant because the work, although demanding, is highly rewarding. I will thrive on the responsibility of being a CNA and get lots of satisfaction from helping deliver outstanding care and treatment that positively impacts patients' lives. I also want to be a CNA because of the career progression opportunities and the chance to specialize in various healthcare fields. This will keep the role varied and interesting as I progress in my career. And finally, I want to be a CNA because of the job security. Competent and effective certified nursing assistants are in demand, which means I will have secure employment, empowering me to support my family and achieve my goals. So that is another unique top scoring answer to one of the common CNA interview questions. Why do you want to be a CNA? And you can see how these answers are going to help you get hired at the first attempt. Now, don't go anywhere because I still have many more tips, questions and answers to give you. But when you are ready, click that link in the top right-hand corner of the video, head straight through to my website, passmyinterview.com, and you can instantly download my 27 brilliant answers to common certified nursing assistant interview questions. But here is the next question I strongly recommend you prepare for. What qualities make you a good fit for this role? Tip number 1. So this next common CNA interview question assesses your knowledge of the job description. This is important. Make sure you study the job description and the person's specification before your CNA interview. In your answer, I recommend you include compassion and empathy, excellent communication skills, adherence to rules and procedures, attention to detail, and adaptability. Now, I've done all of the hard work for you. I have read the job description and the person's specification, and I have created this top scoring example answer that will help you get hired. Here it is. Write it down, take notes. What qualities make you a good fit for this role? The qualities I have worked to develop include compassion, patience, and strong communication. As a CNA, I always demonstrate genuine empathy and kindness, and I remain patient and mindful when managing challenging behaviors or performing repetitive tasks. Other qualities that make me a good fit include attention to detail, adherence to rules and procedures, teamwork, reliability, and physical stamina. I take care of myself meaning I can meet the demands of the role, work closely and selflessly with all healthcare professionals, double check my work, and make myself available to work the hours required to support the hospital in its mission of delivering outstanding patient care. So that is another brilliant answer that's going to help you beat the competition and get hired as a CNA at the first attempt. Here is the next question I strongly recommend you prepare for. How do you handle a difficult or uncooperative patient? Tip number 1. So this next question is often asked in CNA interviews, and it assesses your communication skills and your ability to adapt your communication style to suit the situation you are in. And tip number 2, in your answer, say that you would utilize active listening skills and ask the patient questions to determine what was causing them to be difficult or uncooperative. So here is another brilliant example answer to help you. How do you handle a difficult or uncooperative patient? Patients may become uncooperative due to pain, fear, confusion, or frustration, especially in unfamiliar environments. I always remain calm, respectful, and professional while conducting my duties. For example, in one of my previous CNA roles, I was assigned to a patient who was recovering from surgery. They often refused assistance during personal care routines. To build trust, I began by calmly introducing myself at the start of each shift and explaining each step before taking action. I asked questions, listened to the patient's concerns, and found out that he was anxious about losing his independence. I reassured him that my goal was to support, not control, his recovery. I also gave him small choices, such as when to shower or which clothes to wear, which gave him a sense of control. Over time, his resistance decreased and he began to accept my support more willingly. That is a brilliant example answer that will get you hired. It's a very good response because you are giving a previous situation where you dealt with an uncooperative patient to achieve a successful outcome, which is being able to deliver first-class treatment or care. Here is the next question. This one needs a careful answer. How would you handle a disagreement with a nurse or doctor? Tip number 1. The ability to collaborate with other healthcare professionals is vital to the hospital being able to deliver first-class care. And this question assesses your ability to successfully deal with conflict. Tip number 2. When answering this common CNA interview question, I recommend you say you would remain calm, professional, and focused on achieving positive patient outcomes. So here is another brilliant example answer to help you. How would you handle a disagreement with a nurse or doctor? Here we go. As a CNA, I understand the importance of maintaining professionalism and respecting the chain of command when working with nurses and doctors. If a disagreement arises, I approach it calmly, respectfully, and with a focus on patient safety. For example, during one of my previous shifts, I noticed a patient showing early signs of dehydration. I informed the nurse on duty, but she felt the patient's condition did not require any immediate action. I respectfully explained the specific symptoms I observed, such as reduced urine output, dry skin, and confusion. I spoke calmly and respectfully, and I made it clear that I wasn't challenging her authority, but rather sharing what I had seen out of concern for the patient. After agreeing to review the patient again, the nurse agreed with my observation that further fluids were needed. Our working relationship remained strong, and the patient's condition improved without further complications. So that is another brilliant example response that will help you pass your certified nursing assistant interview. Here is the next question. Why do you want to work for this hospital or medical facility? Tip number one. Now, you must research the hospital or medical facility where you have applied to work as a CNA. Make sure you research it before your interview. I recommend you look at their website, values, achievements, and healthcare mission to gain an understanding of how they operate. And tip number two, good things to include in your answer are how their values align with yours, the positive reputation they have and their workplace culture, and also the feedback you have received from healthcare professionals who already work there. So here is another top scoring example answer to help you pass your interview. Why do you want to work for this hospital or medical facility? Here we go. I want to work for this hospital because you have a reputation amongst healthcare professionals for high standards, your positive culture and values that everyone agrees improve the working environment. I also want to work here because people I have consulted during my research have said complimentary things about the senior healthcare management team, how staff are supported and provided with excellent training to ensure they have the ongoing skills and knowledge to maintain competency. So that is another great answer that's going to help you easily pass your CNA interview. Now, the next thing to do is click that link right now in the top right-hand corner of the video. Head straight through to my website, passmyinterview.com, and you can instantly download these slides with the tips, questions, and answers, plus my full set of 27 certified nursing assistant interview questions and brilliant example responses. You can have everything in your email inbox within 2 minutes from now. Click the link and head straight through to my website, passmyinterview.com. Thank you for watching. Hit the subscribe button. Give the video a like. I really do appreciate your support. And I wish you the very best for passing your CNA interview. Have a great day.